Welcome to Planetary Health First, Mars Next. It is an amazing day. We have Sari with Rock Health, and we got co-host Neil Carpenter, and he's going to be driving this interview today.
So I am so excited to have, and sadly people can't see video, one of the best dressed, most creative people who walks the VIVE floor here, and one of the smartest and most interesting. So Sari, can you talk a little bit about what you do at Rock Health, and what does Rock Health even do? I think it's probably a name everyone hears, but I think it's something people don't really understand necessarily.
And thanks for having me here, Neil and Michael. So Rock Health, the quick overview of Rock Health is we've been around since 2010, focused on digital health. We have three main parts to our business. We have an advisory group that works with enterprise companies and late-stage startups on digital health strategy. We have a nonprofit focused on health equity. And we have a venture fund that invests in early stage digital health startups. So between all of those things, we're really supporting the entire ecosystem.
And because I go to a number of your events, I know a number of folks, I'm privileged enough to know a number of folks who work there. When you talk about an ecosystem, you're not kidding. So at one of your events, can you name some of the kind of companies that or folks that show up?
Yeah, I mean, we have really everyone from payers, providers, pharma companies, tech companies, retailers, startups, investors, really everyone is part of this because we believe that all of us play a role in moving to this new future.
Okay, can you talk a little bit about your background?
Sure.
How did you get to Rock Health?
So currently I'm the Chief Commercial Officer at Rock Health Advisory. So that's the part that I mentioned that works with startups, late stage startups and enterprise companies on digital health strategy. That means I oversee our consulting practice and our research, supporting our members and clients. Prior to this, so I've been at Rock Health for about 3.5 years. Before this, I was at McKinsey & Company for 7 years, co-leading their work on digital health and patient experience. Before that, got my MBA, and before that, worked in fintech and healthcare startups.
So an amazing background. So since you do research on what's happening in healthcare, what do you see as some of the interesting things? What would you talk about people if they sat down with you for dinner tonight?
Yeah, well, probably not work, but otherwise.
Okay. Oh, come on, really? Okay, keep talking.
Maybe a little bit about work. But firstly, we wrote an article called The Innovation Maturity Curve toward the end of 2023. I highly recommend folks check it out. We looked at different innovations and how mature they are along that curve. Some of the things that we highlighted in there are, number one, digital obesity care, which is a really important space as the care paradigm changes with the GLP-1s coming into the market. Yep. And so that changes the whole dynamic around where does digital come into play into that dynamic. The second area of focus that I think is super interesting is food as medicine. Back in the end of 2023, we called it a nascent emerging space. And I would say even in the last 2 months, there's been a real shift and an explosion. So that's another one I would keep an eye on. And of course, you can't be at any healthcare conference without talking about AI and generative AI. Yeah. Obviously, a lot of opportunity there. The other thing I would mention just for folks to keep an eye on is M&A. Yep. I think we're going to see a lot of M&A this year. Of course, I said that last year and I was wrong, but I think this year really is the year because the way the funding cycle worked out, we had a lot of companies starting in this digital health space, a lot of opportunity, but definitely there's room for consolidation. We don't need so many point solutions. It's also been a little harder for companies to scale given the environment. So I think last year we thought we would see it, but it was kind of hard for people to find the match between the price they wanted and the price people were willing to pay. But I think we're starting to see people get a little more realistic, and we will see, I think, a lot of M&A this year.
Sweet. Awesome deep dive on M&A real fast. Let's go back to the top of your list and just give us, what is one or two things happening with obesity? Obviously, there's a spend issue and there's money issues, but how are people navigating it in terms of companies doing innovative things?
Yeah, I mean, within obesity care, and we'll focus more on the digital health side of things, there really is a lot of interesting activity. So there's a number of companies that are offering telemedicine services or async or live to enable folks to get a prescription to GLP-1s. Obviously helping with the access element. There's a number of behavior change solutions that have been around for a long time, more focused on diabetes that are shifting to help with obesity. And we're seeing an emerging space, which I personally am pretty excited about, which is a little bit more oriented around diagnostics, precision diagnostics, and sort of triaging tools that will help identify who needs to get what treatment and potentially in what order. Where I think we need to keep a watch out for the space is, number one, there is a big risk of a sort of big publicity challenge the way we had with ADHD
Yep.
with some of these companies. So I think we need to really keep an eye on that and keep clinical guidelines clear. And some folks may fall into that
By the
trap.
way, this is just why I love Rock. You can actually show up and ask a question and you get like a 10 bullet point answer that's like pretty clear and like fairly comprehensive.
I'll probably throw a framework at you too.
I know, exactly. But you can't doodle on a podcast.
So we definitely, I think that's a risk we have to watch out for. But I think the other thing to pay attention to is because there are so many companies now doing prescription and whole person care support, they need to start differentiating because there's a big mosh pit in people's head of what is the difference between all these companies. And there's differences. But I think we're going to see this year companies focusing on crispening their value proposition and moving more B2B, the ones who were D2C.
And to your point, before we move on to the food as medicine, there's also the chance, as we've seen with some of the drugs you talked about, of having a few maybe bad actors or people who don't do well kind of giving a black eye to the whole space.
Exactly. And the one other thing I would say, if you're an innovator out there, to me the big gap is really nutrition support for people on GLP-1s, right? There's a lot of focus on helping weight loss, but actually when you're on those medications, there's a risk of losing lean muscle mass, other things. And so there needs to be a customized solution for folks that are on the medication to help them be healthy in the long run.
Awesome. Food as medicine, something people would have
Food
talked
as
about
medicine.
and rolled their eyes at 5 years ago. Sorry.
Yeah.
And I might even been one of those people.
Yeah, I mean, what's fascinating about food as medicine, we saw about 17 different partnerships in the last 6 months, so it's really exploded. People mean a lot of different things, though, when they say food as medicine. It can mean meal delivery. It can mean a debit card that you get money preloaded to buy only healthy food. It could mean nutrition advice and support. So it can mean a lot of different things, and I think we'll start to see those definitions and those solutions crispen as the year goes on. But what's interesting is there's also a lot of different ways that can get paid for. Sometimes it's a payer paying for it. There's also government programs, SNAP and Medicare Advantage dollars that can be used for it. What I would like to see this year, and I think we'll see more of, is broadening the use cases for food as medicine. So not just thinking about it as people who don't have access to healthy food, but also like we were talking about with the GLPs, like what does tailored nutrition look like for people on GLP-1s? What does it look like for other people on, with different chronic diseases? And so it's not just for folks who don't have access to healthy food, but everybody
Which
sort
is
of
a
needs
lot of folks, right? So I know I'm asking you to like pick out one of your favorite children, but I'm going to ask you to do that, which is to say, you just talked about a wide range of things. What's the most interesting? If you had to pick one thing, what would it be?
Well, firstly, I will not pick a favorite child. I have 6 of them, and I
I
cannot
was
do
not
that
going to
to
go there
them.
because I was going to. That was my follow-up question.
Not going to do that. But within digital health, I mean, I think for me what's so fascinating is the interplay of the different things with each other. So it's hard for me to pick one because I think, you're going to see the obesity care merging with the food as medicine, the Gen AI opportunities for all of that, the M&A happening in those spaces. Like, I think it's all kind of intertwined. So kind of hard, probably is why I'm a consultant still. It's hard for me to pick one favorite thing.
And you're like, I'm going to reject your your framework as a way of giving you an answer, which I respect. Okay. Quickly, because I know we're doing a lot of quick interviews and you've been very generous with your time, can you talk about AI and particularly generative AI? Because obviously AI has been around for a long time in healthcare.
Yeah. I mean, for me, generative AI is sort of like the new smartphone. The smartphone came out first, everyone's like, what's this cool gadget? But now our whole lives revolve around it, and it's all about the apps that plug into it, right? It sort of changed the paradigm of how you think about innovation and how you think about what tools and technologies are at play. So I see a huge amount of opportunity, and I actually think that using it in our daily lives, it's what's going to push healthcare to start to adopt it. Because you have all these providers saying like, oh, I don't want to use Gen AI for, diagnosing or whatever. It's like, well, when you're starting to use Googling ChatGPT, instead of Googling, I call it Chatty. Sometimes it's easier to say. You'll be like asking Chatty all your stuff in your regular life. At some point, you're going to be like, well, why am I not doing this within the clinical space? I think the big watch out there is to pay attention to what data is the model trained on. Are you using a customized version? Are you not? Like, how do you integrate all of that? But I think it's sort of inevitable. So it's really just about getting really crisp on what is the use case? What are you doing? What is the AI doing? And therefore determining a whole set of things around how do the people have to interact with that thing? What's the output you're getting? How are you engaging with that output, whether it's a clinician or a person, and sort of setting up our system differently. But I think it's sort of an inevitable march to a new future.
On that, I just want to put a pin in something I think really important, what you said, which I think we forget about healthcare sometimes because so many people have only been in one industry their whole careers, and that's healthcare. Which is, I think you're making a point that like, hey, sometimes change really happens somewhere else other than a hospital or a doctor's office, and then it goes to the hospital and doctor's office, whether they kind of want it or not.
Yeah, for sure. I mean, that's sort of the beauty of being in digital health or health tech, however you want to call it. You can just look out there and see what are the technologies that are emerging. Okay, how do I apply that here, right?
Yep.
I mean, that's the cool part. It's like someone else can do the hard work of coming up with the new tech, and we just have to figure out how to apply it.
Yep.
So I'm excited about that.
Sir?
I don't even know where we go from here. It sounds like we just started the first episode of a 3-part.
No, she just took a whole lot of industry thinking and like just bombed that thing out in 7.5 seconds.
Jeez.
Well, if you want to continue the conversation, I'm always up to chat.
Beautiful.
I'm telling you, it was like the generative AI matrix unleashed today.
Yeah, exactly.
Sari, you were amazing. We really appreciate you stepping into the studio today, just sharing all your knowledge. Really enjoyed having you live at VIVE, Planetary Health First, Mars Next. It's been a great day.
Thanks for having me. Although we didn't talk about space, so we must have missed something.
Next time.